Myself Sandhya, Assistant Professor in Department of Pharmaceutics, Yenepoya Pharmacy College and Research Center. Today I will be taking a topic on suspensions. So before going to my topic, I can give a brief notification of my topic or brief overview of my topic. What is this suspensions? Basically, I belong to a pharmaceutics department where we develop a dosage form. Dosage form is nothing but a patable form where an living being substance can take it. It can be for a human use or veterinary use or for a dental use. So when I say about suspension, they basically belong to a liquid dosage form. As we see, liquid dosage form is one of the type of a dosage form and which is very easy to take for a patient, mainly for old age patients and pediatric patients, because swallowing a tablets or capsule, it's very difficult for them. So when we talk about this suspension, they belong basically to a liquid dosage form. Under liquid dosage form, we have two dosage form. One is monophasic and biphasics. So monophasic is nothing but a single phase, where we see syrups, lintases, they all belong to one phasic, such as solute has been dissolved in the form. Whereas biphasic is nothing but a two phases of dosage form, or it is having two substances in it. It is not one system of a dosage form. So here we have two types of one is suspension and emulsions. So I will be talking about the biphasic dosage form, where I will be talking about suspension. As we see the word, they are telling that particles are being suspended. I will give an overview of today's topic. So my table of content is a brief introduction of suspensions. So specific learning objectives of today's class is nothing but you should know the definition of suspensions, classification, advantage, disadvantage and qualities of a good suspension. When we formulate a suspension, what are the basic requirements for a suspension dosage form. So firstly we will see what is a definition of a suspension. In the beginning of the class itself, I have told you suspension are nothing but a biphasic liquid dosage form. Biphasic word indicates that it is having a two phases. So what are these two phases? The two phases are commonly known as internal phase and external phase, where internal phase will be having a solid particles where they are not being dissolved, they are being suspended or dispersed in a liquid media, and that will be its external phase. So how can we define a suspension? Suspension are a liquid dosage form of a medicament in which a finely divided solid particles are ranging from 0.5 to 5 microns are suspended or dispensed in a liquid or semi-solid vehicles. So when you see the size of a particles, they are in the form of 0.5 to 5 microns, means they are not visible, and if they are visible also, because of the accumulation in the less density, they will be viewed. But when we resuspend it, all the particles will be forming in the form of a thick solutions. So suspensions are a formulation where we have particles are being suspended or dispersed, and the particle which is suspended or dispersed are known as internal phase, and in which a solution they are being dispersed or suspended is known as a external phase. So internal phase. When we define the suspension, we are told it is having two phases. So first phase is known as internal phase. Internal phases are insoluble solid particles, and what is the size? Size should be 0.5 to 5 microns, because the larger particles will not be patable for taking as a liquid dosage form. They can irritate our oral mucus. Sometimes a patient can also feel like vomiting out. They may not be entering into our digestive system or into our stomach. So in order to avoid it, the particle size have been reduced, and also to maintain it uniformly suspended, we maintain the particle size at 0.5 to 5 microns with the aid of suspending agent. Suspending agent are the particles which have been added to that, so that either the density of the two media is reduced or increasing the viscosity of that medium. So once the viscosity is reduced, the particles will not settle down very easily, or when the suspending agent is added, they will be moving within the media. So we will be adding the suspending agents. So this is the first phase of a suspension. Coming to a next phase is known as external phase. So external phase is nothing but a suspending medium. It is generally a solution which is used for a preparation of a suspensions. So usually your internal phase will be containing the medicaments. These medicaments are not soluble in the given solvent. The solvent which is used for this is known as a external phase. They can be either organic, aqueous or oil solutions, mainly for non-oral use. So suspension are not only used for oral use, they are also used for external use, and they are also used for the parenteral use. Parenteral use, mainly they are prescribed to have a depot effect. Depot effect means they will be having a sustained release or controlled release. So when we take a vaccination or when we take certain type of injection, the immunity of the injection will be provided to a certain period of time, that can be 6 months to 1 year, or sometimes that immunity can be produced for 1 year, because they will be releasing the medicament in the depot system. They will be stored in our muscles. For that we will be using oil solutions, and oil solutions are not preferable for a oral solution. So for any other oral use, we will be using as a oil as a solvent. Organic and aqueous are used for a oral use and also external applications. So definition of suspension is over. We will go to the next part or next topic in the suspension is nothing but a why we require a suspension. So basically, if a substance is soluble in a solvent, we can make it as a easy formulations. But why it is required to be changed into a pharmaceutical suspensions? Mainly, first reason for converting them into a suspension is that to mask a bitter taste of a drug. Drug is nothing but a active pharmaceutical ingredients. They will be having a pharmacological effect. Pharmacological effect means after we take the medicines, the body or the system will block some systems, such as receptors will be acting on a targeted sites. For example, they will be increasing the activity or decreasing the activity. For example, in case of fever, when you have a fever, there will be increased in body temperature. Our inflammatory enzymes will be more. So after when we take a paracetamol syrup or paracetamol suspensions, they act on our inflammatory enzymes. They stop the synthesis of our inflammatory enzymes. Hence, our body temperature reduces or body pain reduces. But these paracetamols are bitter in taste or they are insoluble. But if you solubilize them, they will increase the bitter taste, and the patient will not be able to take it. They may feel other nausea or vomiting type of sensation before they are taking the medication. In order to avoid it, we give them in a suspended formulation or suspension formulations. And second reason why we have to convert into suspension is nothing but to increase the drug stability. Drug stability is nothing but to increase the drug shelf life. During the storage period, the drug has to not undergo any degradation, or it has to not undergo any chemical incompatibility or physical incompatibility. So if it is not solubilized, if it is kept in a stable manner, is a suspending formulations. So they maintain the drug to be in the stable form. And third reason why we are converting into a suspension is nothing but for a control and sustained release. So when we see after taking a medicine, the drug will be entering into our GIT region. When the drug enters into our GIT region, they have been solubilized in the GIT fluid. From there, the particles have been absorbed by the cells and they will be circulated to all our body. But when the particles are given in the suspension formulations, they have been coated with suspending formulation agent. So all the particles will not be at once solubilized. They will be solubilized slowly. Hence, the solubilization is been reduced. Once the solubilization is reduced, the penetration is also reduced. In this manner, we can have a control or sustained release of the drug. So when we have a controlled or sustained release of the drug, frequent dosing of a drug is not required. The dosing can be reduced. Once the frequent dosing is not reduced, most of the area, that is adverse drug reaction of a drug, also can be reduced. So these are the three main reasons why we have to formulate into the suspension, not into other easier form. So when you compare to the monophasic dosage form, they are little difficult to formulate, but they are having a more benefits. When the benefits are more, we try to convert them into suspensions. So these are the three reasons why we have to convert them into a suspension formulations. So next in this is nothing but a classification. how do we classify the suspensions? So generally based on their uses or general classification, what are the formation of a suspension are being taken. So they are being taken orally, they are also taken externally and also parenterally. Orally is nothing but taking via oral cavity, and it will be entering into our digestive system. From there it will be absorbed and circulated into the systemic circulations. And the example is nothing but paracetamol suspension. We have n number of paracetamol formulations for a pediatric patients such as Calpol, Dolo. These are the brand names and they come in the different formulation. Whereas drops, they belong to the monophasic liquid dosage form. Whereas paracetamol, they also come in a syrup form, but preferably most of the doctors prescribe the paracetamol suspensions, mainly because they have less bitter taste, and the control and sustained release is also absorbed in the suspension formulation when you compare to the syrup formulations. There are certain antibiotics, or most of the antibiotics are also coming in the powder form of the suspensions, where the patients are they have asked to be reconstituted with the water and to be taken. After once we reconstitute into the water, they has to be used within a certain days. This precaution also be taken. Next type of general use is nothing but externally applied suspension. Externally applied suspension, the best example is a calamine lotion. Calamine lotion is nothing but antiseptic lotions, or it is also used as anti-infective lotions. They have been applied externally. So this formulation is also belonging to the suspension class. Next one is parenteral suspension. Parenteral suspension is nothing but they have been injected into the intramuscular regions, not into intravenous or other regions, because they act as a depot and mostly they will be containing oil as their solvent. So these have been mainly given into intramuscular regions, and some are also given as a subcutaneous also. So best example is our insulin injections. Based on general uses, we have three categories. One is oral suspension, second one is externally applied suspension, and third one is parenteral suspensions. So this is a first type of a classification, that is main heading is based on general classes. Second one is based on the amount of active pharmaceutical ingredients or a drug or a internal phase has been present, that is not where suspended particles. There are two types, one is dilute suspension, other one is concentrated suspensions. When I say dilute, the solid substances will be 2 to 10%. When I say concentrated suspension, they will be 50%. So usually diffusible solids are given in the dilute suspension, whereas indiffusible solids have been given in the 50%. So best examples are nothing but corticosteroid acetate suspension and prednisolone acetate suspension. Whereas concentrated suspensions, mainly they are used for external application, few are also used for internal application. Your calamine lotion also belongs to the concentrated suspensions, whereas zinc oxide suspension also belong to the concentrated suspension. This is the second type of a classification. First type of a classification based on general use, where we had oral use, external application and parenteral. Whereas second one is based on the proportion of solid particles, where they are diluted suspension and also concentrated suspension. We are coming to the third type of a classification, that is based on the electrokinetic nature of solid particles. So kinetic is nothing but something we are studying when they are in the movement. Particles when they are in the movement is known as kinetic, and electromons, because of the charged particles they are moving. So here in suspension, in the beginning of the class only I have told you, they will be adding a suspending agents. Suspending agents will be containing a charged particles, and because of the charged particles, the suspended particles are made to be keep on moving in the external phase, because they are not soluble. If they are soluble, they may change in the stability, they may also increase the bitter taste of the preparations. So we have two type of electrokinetic properties solid particles, that is focculated suspension and defocculated suspensions. When I say focculated suspensions, they are mainly containing diffusible solids. Diffusible solids are the powders or the solid particles which are having less density than the external phase. So when you keep this powder, they will easily settle down in that. They will not form a clog. They will get easily moved to the low bottom region of a preparation. Whereas defocculated suspensions are nothing but they are having higher denser, they are indiffusible solids, they sometimes will be hydrophobic in nature. So what happens is they don't settle down easily. If that all they settle down, they will form a hard cakes. So usually these are the two types of a suspension which are they based on the electrokinetic, that is movement of the particles in the suspended internal phase, that is nothing but focculated suspensions and defocculated suspensions. When you see the formulation, usually focculated suspensions are available in the market, whereas defocculated suspensions are for external uses. Focculated suspensions are for oral uses. So this is a third type of classification. First one was based on general uses, second one was based on the concentration of the solid particles, and third one was based on the electrokinetic nature of the solid particles. So coming to the next type is nothing based on the size of solid particles. Size is nothing but, as we saw in the beginning of the class, we have mentioned that particle size should be 0.5 to 5 microns. So based on the size, what size the particles are there, based on the size we are classifying the suspension. First one is colloidal suspension. When I say colloidal suspension, the particle sizes are greater than 1 microns. They will have a particle sizes of suspended particles, less than 1 microns, and they are known as colloidal suspensions. So if the particles are less than 1 microns, then they are known as colloidal suspensions. So micro size are not visible in the analysis, but when if at all they are settling down, they will come to know. So in this type of suspensions, they are known as colloidal suspension. Next one is coarse suspension. Coarse suspension is nothing but opposite to the colloidal suspension. In colloidal suspension, we have told that they are less than 1 microns. Here they are more than 1 microns. So 1 micron size are the particles, and they also belong to the focculated suspension types only. The particles are rigid and then we can be easily seen. Next one is known as nano suspension. Nano suspensions are the particles which are less than 0.5 microns. The suspensions are having the particle size 0.5 to 5 microns. Now they are having less than 1 micron, or they are less than the micron size, that is they are in the nano size. So these type of suspensions mainly belong to the defocculated suspensions. So these are based on the particle size of an internal phase. So this is the fourth type of a classification of a suspension. So there are 4 types of classification of a suspension. First one is based on the general use. Where we have oral suspension, externally applied suspensions, and parenteral suspension. Second one is based on the proportion of solid particles, such as dilute suspension, where it is having 2 to 10 weight of the percentage of the particles, and we have concentrated suspension, where we have 50% of the solid particles or internal phase have been present. Coming to the electrokinetic nature of solid particles, here we have focculated suspension and defocculated suspension. Focculated suspensions are diffusible solids. They are having less denser than the external phases. They have been easily settled down, whereas defocculated suspensions are indiffusible solids. They don't settle down easily. If they at all they settle down, it is not easy to redisperse it, whereas in focculated suspended, it is very easy to redisperse it. So this is based on electrokinetic nature of solid particles. And next is based on the size. We have colloidal suspension, we have coarse suspension, and also we have nano suspension. Colloidal suspension is having a particle size less than 1 microns, whereas coarse suspension is having a particle size greater than 1 microns, and nano suspension is a suspension where the particle size is less than 1 micron, or they are coming in the nano size. So these are the 4 types of classification of a suspension. Next is advantages of suspensions. So we have seen why we need to convert them into suspension formulation. That is, they mask the bitter taste of the suspension, they increase the solubility of the suspension, and also they also give a control and sustained release of drugs which are present in the suspension formulations. So first advantage is that they can improve the chemical stability of certain drugs. So when you give in a syrup form, or when you give in a monophasic type of a formulation, they are chemically unstable. They may undergo a chemical incompatibility, or they may undergo a physical incompatibility. So it is better to convert them into a suspension forms. In a suspension form, we are not solubilizing the drug molecules. We are adding a suspending agent or a wetting agent, or increasing the viscosity of external phase. So the particles are dispersed or dispensed in the dispersed or suspended in the given solvent. And next advantage, it is like drug in the suspension have a high rate of bioavailability than compared to other dosage form, mainly because they are they are not been solubilized. So once they enter into the system, enter into GIT, the rate of solubilization has been very slow. Once they are very slow in rate of solubilization, but they have a high permeability also, but they are able to solubilize in very slow. So once they have been solubilized, then they permeate. So the drug available for metabolism rate is very less, hence the bioavailability of the drug has been increased. So this is the second advantage of suspension formulations. And compared to the stability life, whereas monophasic solutions or any of the formulations is having a less shelf life when compared to a suspension formulation. But when compared to a solid dosage form, the shelf life of suspensions are also less. So they are stand in between a shelf life. They have a medium shelf life when compared to the other dosage forms. And coming to an onset of action. So an onset of action can be controlled. They give a controlled release. So when a medicine has been pre-programmed to be released, so the frequent dosing of a drug is not required. So frequent dosing of a drug, instead of taking twice a day, thrice a day, once taking a medicines will be giving a action for a whole day. So suspension is also having a parameter of controlled release. And coming to the fourth advantage is nothing but they can mask the unpleasant taste and bitter taste of a drug. The drug is having a bitter taste. So drug can be from any source. They can be from a natural source, synthetic source, or they can be also from a metallic source. But the taste of most of the drugs are bitter, or they has to be masked by adding a flavoring agent or by adding a sweetening agent. But here in suspension, the drug is not solubilized, and drug is also coated by a suspending agent or venting agent, and it's like just encapsulating the drug. So the taste bud of a oral system is not having a direct contact with the drug particles. So if the taste is bitter, it has not been recognized by our sensory organs because of converting them into a suspension formulation. The best example is chlorophenol suspension. So these are the advantage. There are other advantage similar to the liquid dosage form. That is, they are easy for administration of a pediatric patient, or also and also geriatric patient who has difficult in ingesting the medicines. This is one of the advantage of a liquid dosage form. And also they will be giving a multiple doses, and it can be also stored for a shelf life of 2 years to 3 years. So these are the few set of advantages which is similar for all the liquid dosage forms. Main advantages, they are also been masked according to the taste of a patient. It can be flavored or it can be colored, and also it can also be change the taste according to the category of a patient we are giving, because pediatric patients are very having a sensory, they are very much attracted to the dark colors, or taste of that can be also be enhanced, or it can also be masked according to the requirement of the patient. This is also one of the advantage of a liquid dosage form, which is also applicable for a suspension formulations. So coming to the last one is nothing but disadvantages of suspensions. So here the particles are not been solubilized, they are they have been suspended or they have been dispersed in the media. So the formulation is very tricky, and the person who has been worked on it only can be there. If any change in the formulation step can leave for a physical stability, incompatibility such as sedimentation or cracking, creaming. So these type of problems are very common in a biphasic liquid dosage form. It can be suspension or emulsion, whereas in monophasic this type of drawbacks is not seen, because we are trying to solubilize the substances and we are making it in one system. And also if the substances are not solubilized, we can use any one technique of a solubilization to make it solubilized. But in suspension, we are coating the particles with a suspending agent or wetting agent, or sometimes we increase the viscous of internal phase or external phase because of improper storage or because of undue condition due to environmental condition. If any one parameter also interferes in that, the physical stability of a suspension can be hindered, because this mainly for oral uses they come for a multiple dose. If the patient who is consuming it is not storing in the proper condition, the physical stability can be easily seen in a suspension or emulsion type of a formulation. So this is very important to be noted, and it is a bulk. Sufficient care must be taken during handling and transportation. So packaging, usually it is done in the glass vase, and when you compare to the single dosage forms such as tablets or anything, it is very bulk to carry, and they are coming in the multiple doses of 30 ml to 60 ml. So these are other drawbacks of a suspension dosage form, which can also increase in terms of economic of a patient, whereas tablets can be cheaper. It can be also, according to the dose, it can be also purchased, but once you are purchasing, it has to be taken. So that is also one of the drawback of a suspension formulations. And other disadvantages is nothing but it is difficult to formulate. We have to select the suitable suspending agents, wetting agent to coat the particles, and also see the density between two particles. Because of coating, they should not convert into defocculated or focculated dosage forms. So this is also very difficult when you compare to the monophasic liquid dosage form. Next is, there is uniform and accurate dose cannot be achieved unless suspensions have been packed in a unit dosage forms. So uniform and accurate dose cannot be achieved, because usually when we dispense or when we prescribe the medicines, suspensions are being given with the auxiliary label that it should be shaked well before using, because for a accurate dosing, and most of the liquid dosage form are very difficult to get accurate dosing if though they measure it in a proper amount and give, or due to undue condition or due to storage condition, the accuracy of the precise of the medicament is is comparable easy to a unit dosage form, whereas in unit dosage form such as tablet and capsules, one unit is being precisely and accurately packed. That is not possible with a liquid dosage form. So here I end my session by giving a summary of the today's class. That is nothing but we have discussed about the definition of suspensions. So definition of suspension is nothing but it is a biphasic liquid dosage form which is containing a insoluble solid particles. It has been suspended or dispersed and having a particle size of 0.5 to 5 microns. It has been dispersed in a external phase, and external phase can be organic or oil, or it can be aqueous, whereas oil type of external phase are used for a parenteral use. And suspension is containing an internal phase and external phase. Internal phase is nothing but a solid particles. It is having a size of 0.5 to 5 micron. It has been suspended or dispersed in external phase. External phase can be aqueous, oil solutions, or it can also be a organic solutions. Why we require to convert them into a suspension? First one is they will have a better stability life. It can mask the bitter taste of the drug, and also the drug can have a control and sustained release. Coming to the classification of suspension, there are 4 types of classification. First one is based on general use. General use, it can be oral preparation, external preparation and parenteral preparation. Coming based on their solid particles, that is concentrated suspension and dilute suspensions. Based on the size of solid particles, colloidal size, core size and nano suspension. And last one is nothing but based on electrokinetic parameters, that is flocculated and deflocculated suspension. When you see the advantage of suspensions, they can mask the bitter taste of the drug, they are giving controlled release and sustained release, and also they have a suspension formulation are having a higher bioavailability compared to the conventional monophasic liquid dosage form. Bioavailability means the amount of a drug is been reaching the required site of action. So if you have a more bioavailability, the frequent dosing of the drug also can be reduced. So these are the advantages, but still they have disadvantages, such as they were very difficult to be formulated, and also storage should be done properly. They are little bulk when you compare to the other unit dosage forms, and accurate dosing is also very important in case of a suspension which is not pre-programmed. It has been measured and taken by the patient peoples. So when we formulate a suspension we are formulating as a insoluble solid particles. So they are basically insoluble, but we have to formulate in such a way that when we redisperse the patient and until it consumes, all the particles should be dispersed. They have to not be settled down. That is the most important criteria we have to learn. And if at all the particles are settling down, they should also be redispersed. And the storage condition of a suspension should also be taken proper care. When we store in undue condition or frequently changing the storage condition will lead to the change in their stability life, and also lead for the deflocculating or settling down of the particles. If some particles settle down, they can be redispersed, whereas if deflocculated suspension are settling down, there is not possible of redispersing the particles. So these are the parameters you have to take it into note when you formulate and also when you consume a suspension formulations. These are my references. Thank you.